Hello, everyone. Welcome back to our channel, Hawthorne Oncology Pain Experts. My name is Dr. Podgorski, and I look forward to discussing the next topic in our series on intrathecal drug delivery for patients. So in last week's video, we talked about the basics of intrathecal drug delivery, including what is intrathecal drug delivery, defining some of those terms, and who is a good candidate for intrathecal drug delivery. Today, we're going to go to the next step. After a doctor decides that you're a good candidate for intrathecal drug delivery, what are the next steps in getting your trial and then eventually getting an intrathecal pump implanted? So stay tuned and hope you enjoy the content. So before patients get an intrathecal pump implanted, the majority of patients need to go through what's called an intrathecal trial. While we won't discuss the details of an intrathecal trial today, we'll just say that an intrathecal trial is a test whether or not that medication is going to be effective and whether or not it's going to cause any side effects. Before you proceed with the trial, there's a few steps that need to happen first. So generally speaking, doctors will have several steps involved before proceeding with your intrathecal trial. In my practice, I have about 5 steps that I make patients go through before they get their intrathecal trial. That will change based on patient circumstances, but generally speaking, we have about 5. So the first one that's always required is for us to send the insurance company a request to approve your procedure. It's really important that your doctor appropriately documents what your reason for getting the pump is. And doctors who do a lot of intrathecal drug delivery will know what those diagnoses are and appropriately document that so that the insurance companies will approve your procedure. Now, generally speaking, that takes 1 to 2 weeks, sometimes a little bit faster if we're talking about cancer patients, but there is a time frame for that process to occur. While that's going on, simultaneously, your doctor will refer you for what's called a behavioral health evaluation. That evaluation sometimes falls under a psychological evaluation or is known as a psychological evaluation. That doesn't mean that we're worried about you having a psychological issue, but we know from experience and from evidence that it's really important to make sure we tease out if there are any underlying issues. And if there are any underlying issues, that doesn't mean that you can't get an intrathecal pump. We know that pain sometimes can exacerbate some of those issues and that it's important to treat that. So it's just to make sure that if you do have one of those issues, that you get the proper treatment and that issue is stabilized prior to proceeding with the pump implant. Again, we know that outcomes are better when we make sure that we address these issues up front before you go ahead and get an invasive procedure like an intrathecal pump. So these are some of the steps that will occur, and there's a few more after that will happen as well too. So insurance approval is always required for every patient, whether you're a chronic pain patient or a cancer patient. With respect to the behavioral health evaluation, that is always going to be required for chronic pain patients. And in the majority of cases with cancer patients, it will not be required. The reason for that is that insurance companies and physicians know that time is really important for cancer patients and that we want to proceed with trialing and implanting as quickly as possible. And most doctors will argue to forgo the behavioral health evaluation. So there's a little bit of difference there between chronic pain patients and cancer patients. So the 3 additional items that I like to address prior to proceeding with the trial are 1, your medications, 2, any imaging that needs to be reviewed beforehand, and then also looking at some of your comorbidities or other medical conditions and making sure that those are optimized first. We certainly don't want to go forward with any trial on a patient who has unstable or untreated medical conditions. So an example of that would be a patient with uncontrolled diabetes. We look at numbers on your labs to just make sure that everything is well managed. People who have underlying cardiac issues and are going through either some chest pain or shortness of breath, These are all things that your doctor will look at and make sure that you're a good candidate and safe to proceed with the trial or implants. As for imaging, we want to make sure that we know what your back looks like, make sure that there isn't anything that we would need to avoid or think about beforehand. Essentially, that helps your physician plan moving forward in a safe manner. It's also good to see if maybe there's something else that needs to be addressed before proceeding with the trial or implant. Now, with respect to medications, everyone handles this differently. So there's a lot of evidence out there that suggests that, decreasing some of your oral medications, specifically your opioid medications, is really important and has suggested that we can generally end up with lower doses in the intrathecal pump if we work on weaning some of those medications beforehand. From a practical standpoint, if you are, being managed on high dose opioids, how are you really going to know that you're getting a benefit from this therapy? We certainly need to reduce some of those medications, see what the underlying pain is like, and actually after the trial, see what your pain relief is after you get that intrathecal injection. So it's really important to try and decrease some of those medications. There are different philosophies. Some doctors will wean you off of all medications for a set period of time before you do your trial. Some doctors will wean a certain percentage, 30 or 50%, for example, and then other doctors will continue your medications as is. I do think that it's important to reduce some of your medications for some of the reasons I had already mentioned, but it's also a safety thing, and sometimes actually reducing some of those medications can improve your pain because you have a hypersensitivity to that pain because of the opioids. So I do think it's important. I usually stratify patients whether they're high dose opioid patients or low dose opioid patients. The other category would be cancer patients. Simply put, there are just some patients that it's not practical to reduce medications or reduce them significantly. But that is something that your doctor will consider as well too. So those are the steps involved before proceeding with an intrathecal trial and eventually an intrathecal pump implants. While these steps may seem like a lot, they're very important to make sure that you get the efficacy or effectiveness that you deserve and that the trial process itself is safe. So that's it for this week's video. Next week's video will focus on intrathecal trials. We hope to see you next time. Please don't forget to hit the like button, click the bell, and the subscribe button to make sure that you stay up to date for the next upcoming videos. Thank you and have a nice day.